Have you been taking magnesium glycinate and wondering when it's actually going to kick in? That's one of the most common questions we hear. And the honest answer is, it depends. Magnesium is involved in hundreds of processes in the body, from energy production to muscle function to sleep. So when you start supplementing, the timeline for noticing a difference really varies depending on what you're trying to address. If you're taking it for muscle cramps, some people notice relief within hours to days. That said, it's worth knowing that NICE guidance doesn't routinely recommend magnesium for idiopathic leg cramps, the everyday kind without a clear underlying cause, because the evidence of benefit is limited. So if cramps are your main concern, it's worth having a chat with your GP about what's actually driving them. For sleep quality, improvements tend to emerge over 1 to 2 weeks of consistent use, though the evidence here is mixed, and it won't work the same way for everyone. And if you've had a long-standing deficiency, it can take several weeks to months to properly replenish your body's magnesium stores, because around half of your body's magnesium is held in bone tissue, not in your bloodstream. That last point is worth sitting with. A standard blood test may not fully reflect your magnesium status, because serum levels are tightly regulated and represent only a small fraction of what's stored in your body. So, what is magnesium glycinate exactly? It's magnesium bound to the amino acid glycine. This combination may be better tolerated than some other forms with potentially fewer digestive side effects. In the UK, it's classified as a food supplement, not a licensed medicine, so it's widely available, but that doesn't mean it's without considerations. And importantly, supplements should never replace a varied, balanced diet, a healthy lifestyle, or any prescribed treatments. Several factors influence how quickly it works for you personally. Your baseline magnesium status matters. The more depleted you are, the longer replenishment takes. Consistency is key too. Taking it regularly rather than sporadically makes a real difference. Your gut health plays a role as well, since magnesium is absorbed in the small intestine, and anything affecting digestion can affect absorption. Certain medications can also interfere. Proton pump inhibitors, diuretics, and some antibiotics can affect how your body absorbs or excretes magnesium. If you take antibiotics, levothyroxine, bisphosphonates, or other interacting medicines, ask your pharmacist about spacing your supplement by several hours. They can give you personalized guidance based on what you're taking. When it comes to how much to take, always follow the amount advised on the product label or by your healthcare professional. Don't exceed the recommended amount without professional guidance. And if you experience digestive symptoms like diarrhea, nausea, or stomach cramping, review your dose with a pharmacist or GP. Any suspected adverse reactions can be reported through the MHRA yellow card scheme. There are some situations where you should speak to your GP before starting. These include if you have chronic kidney disease or heart block, if you're taking multiple medications, or if you're pregnant or breastfeeding. Your kidneys play a key role in regulating magnesium levels, so any condition affecting kidney function is particularly relevant. How do you know it's working? Signs to look out for include fewer or less severe muscle cramps, improved sleep, reduced fatigue, and a general sense of feeling more settled. These changes can be subtle, especially early on, so it's worth keeping a note of how you feel over time. To recap, magnesium glycinate may work within hours to days for muscle cramps, though evidence for this is limited. 1 to 2 weeks for sleep improvements, and several weeks to months for correcting a longer-term deficiency. It's generally well tolerated, but always follow label guidance, check in with your pharmacist or GP about interactions, and seek advice if you have any underlying health conditions. If you found this helpful, leave a comment below. We'd love to know what you're using magnesium glycinate for and how it's going. Give this video a like and subscribe to the Bolt Pharmacy channel for more straightforward, evidence-based health content. We'll see you in the next one.